Hello, viewers. Uh, Welcome back. I hope you all have vaccinated yourself. And because this is a very special episode, especially for those people with epilepsy who have been sending me messages and regarding the queries about whether they, during this COVID time, they should vaccinate themselves ki nahi. And so far, I've been interviewing only epileptic patients, but today I'm very, very nervous because I'm interviewing a neurosurgeon, a very highly affiliated neurosurgeon from PGI Chandigarh, uh, Dr. Param Kharbanda. And sir is, I can't even speak the word. He's awarded a clinical epileptology fellowship by the Epilepsy Society of Australia 2000 in 2005. Welcome aboard, sir, and thank you so much for giving us your valuable time. We are very, very grateful. You are here to clear our doubts about COVID and epilepsy. With all the OPDs closed and some questions have come to me via my page, my WhatsApp number from few epileptics. So you all are very, very grateful आप आए हैं. So please, thank you. Dil se thank you from creating epilepsy awareness. So please help us out. Welcome here.
Thank you, Preeti, and thank you for having me here. It's my pleasure to come here and disseminate. You're doing very good work disseminating knowledge about epilepsy and writing that wonderful book about epilepsy. So I'm happy to contribute to your efforts to bring about correct knowledge to people. Just a small correction, I'm a neurologist, not a neurosurgeon, but that doesn't matter. I'm a medical neurologist with obviously taking care of epilepsy program.
So there are a lot of thanks to the media, the forward WhatsApp messages, there are a lot of, and the OPDs clothes, there are a lot of myths floating around regarding COVID and the COVID vaccine and epilepsy. बहुत पेशेंट्स पूछते हैं, फ्रेंड्स सर्कल में पूछते हैं कि epilepsy पेशेंट्स को should we go ahead and take the vaccine or not? प्राइमरी क्वेश्चन ये है कि वैक्सीन लेने से सीजर्स और ट्रिगर होंगे, बढ़ेंगे कि नहीं बढ़ेंगे. दिस इज द मोस्ट इंपॉर्टेंट क्वेश्चन. शुड वी टेक द वैक्सीन और शुड वी नॉट टेक द वैक्सीन? what do you as a doctor, as a neurologist, what do you best advise?
Yeah, good question. And so I want to clear that doubt that as far as I know, there is no evidence that patients with epilepsy are at a risk of higher complication from COVID vaccine, or COVID vaccines can cause worsening of seizures in epileptics. So ऐसा कुछ नहीं है. So the people with epilepsy can go ahead and take the COVID vaccine. There is no real reason to fear that it will cause worsening of epilepsy. Only as I mentioned, there are a small percentage of people whose seizures may be triggered by fever of any kind, and viral fever or otherwise any fever sometimes triggers seizures in some patients, and the fever which may accompany the vaccine or follow the vaccine can have that small chance of triggering a seizure in people who have this preponderance, or who have this already a history of getting fever related seizures. So they have to be a little more careful, and what is recommended is that if you have a history of seizures happening after fever, post-vaccine, you can take medicine like paracetamol in the usual doses for the next 48 hours or so that you really don't have high fever and that does not precipitate seizures. But that is a very small percentage, and most of the people of epilepsy will behave normally like any other patient who's taking a vaccine.
So another important question is like a lot of people are saying, because they see the news, so much of blood clotting is happening in the brain of COVID patients, and suddenly they see news में दिखाते हैं कि उसको seizure हो गया है. So does that that a COVID patient को seizure हो गया है? So does that and the person had taken the vaccine, and despite that he got admitted, he got COVID, he had a seizure. So people are getting scared, that usko vaccine bhi hua hai, seizure bhi hua hai. So that is also, they are getting scared, uski wajah se hum vaccine nahi le rahe hain. So what do you say? Please clarify that doubt as well.
Okay, so this clotting and seizure which we're talking about. So seizures, as I already said, there is no direct correlation with the COVID vaccine, but COVID infection can cause seizures in a way. If the infection and inflammation reaches the brain, sometimes it can cause seizures itself. Regarding the clotting, what we're hearing in the news and all is an extremely uncommon and rare side effect, like few cases in a million, with some clots happening, including in the brain. People having some type of COVID vaccines available all around the world and including in our country. So that is the thing, that is what is being talked about. It is very uncommon, rare, and people with epilepsy are not more prone to these clots than other people are. So there is no evidence that people with epilepsy will have more clots in the brain due to vaccine. So that rare percentage, whatever the other people have it, the same would be in the case of people with epilepsy.
So it is very, what you're trying to say, it is very normal, something any other person who is not epileptic can also develop seizure despite having the vaccine or not having, right?
That clotting, I'm not saying seizure, clotting can cause seizure sometimes.
Yeah, the clotting,
but the side effect noted is the clotting. Yes, it can happen to anyone. In a very rare circumstance, it could happen to anybody.
And sir, suppose जैसे slots मिल रहे हैं, vaccine के slots मिल रहे हैं, किसी को slot मिल गया है and he has to go next morning for the vaccine, and the person who is an epileptic, and the anti-epileptic drugs which he has to take, are there any precautions he needs to take? Medicine नहीं लेनी है time पे लेनी है, anything? And I mean, are there any kind of कुछ मन में रखना है जाने से पहले medicine, or he has to tell the nurse, the doctor कि मेरे को कौन सी दवाइयां लेनी है, anything like that for the vaccine?
कोई स्पेसिफिक तैयारी की जरूरत नहीं है, अपार्ट फ्रॉम जो मैंने पहले ही बता दिया. अगर फीवर है तो पैरास्टामोल ले सकते हैं. अपार्ट फ्रॉम दैट अपनी नॉर्मल जो एंटी एपिलेप्टिक मेडिसिन लेनी है, कोई कम ज्यादा लेने की जरूरत नहीं है. नो रियल प्रिपरेशन इज रिक्वायर्ड फॉर दैट डे as far as anti epileptic drugs go. And we should not miss our drugs, because missing the drug can cause seizures. We all know that. You can drugs act for limited number of hours, and even missing a single dose can cause seizures. तो उसको मिस नहीं करना है दवाई को, बट बताने का इट्स अ गुड आइडिया. वहाँ पे जो भी आप सेंटर में जाते हैं उनको बता दीजिए मेरे को एपिलेप्सी है, उसकी ये मेडिसिन ले रहे हैं हम. एंड कोई और भी अगर मेडिकल प्रॉब्लम है, जैसे कोई एलर्जीज हैं या कुछ हैं, इट इज गुड दैट द डॉक्टर और द नर्स और द मेडिकल पर्सन जो भी वहाँ पे उसको आइडिया होगा, and they can take proper precautions while giving. Like if, as I said, somebody is very prone to having seizures after fever, उनको बता देंगे कि आप पैरासिटामोल खा लो, गाइड कर देंगे कि कैसे करना है.
So one thing is there, immunity is a very major factor where COVID is concerned. Everybody is trying to build the immunity these days, because of COVID. So this is something about epileptic patients. Is the immunity low as it is due to epilepsy? What should they do like to build the immunity? In COVID times, and will a vaccine help them build the immunity stronger?
See, there are two different questions. Yes, vaccine of course will help us build immunity against COVID infection, but as far as epilepsy concerned, again इस मामले में भी वो कोई ज्यादा अलग नहीं है. So it is not ऐसे कि epilepsy वाले patient की जिनको seizure है सबकी immunity low होती है. Not like that. Yes, there are some epilepsies जिनमें immunity deranged होती है, but that is a very entirely different thing. So उसमें अलग से precaution लेने का जरूरत नहीं है. Epilepsy patients can sometimes be more prone. ये कुछ evidence आया है कि if you get COVID infection, they can be more prone to hospitalization or complications. It is not clear क्यों. Maybe it was done जिसमें some patient जिनको बहुत severe epilepsy होती है, जो bed bound होते हैं और जो nursing homes में होते हैं और जिनको lungs issue भी हो जाते हैं, उसके कारण होता हो. So, but there is a data to show that COVID की, not vaccine, COVID की complication rate may be slightly higher in epilepsy patients. So, but जहाँ तक anti-epileptic का सवाल है, they don't need to do something, no specific for immunity. जो immunity आपकी बननी है, दूसरों पे भी बनेगी. And just अपनी medicine लेके, medicines का भी कोई COVID vaccine के साथ कोई ज़्यादा interaction नहीं है आपस में. There is no कि उनका effect कम होगा या ज़्यादा होगा. So you can continue taking medicine and take your vaccine along with it.
So anything special tips you want to give to epileptics who are going through this pandemic? Any special tips you want to give?
So ये जो है, it's very important because पीछे lockdowns भी रहे और बीच में अब तो थोड़ा सा बेटर है. लॉकडाउन में मेडिसिन मिलने में मुश्किल हो रही थी. सो मेक श्योर दैट यू बाय योर मेडिसिन इन टाइम, गेट योर प्रिस्क्रिप्शन इन टाइम, सो दैट बिकॉज ऑफ दिस डिफिकल्टी, हालांकि मेडिकल शॉप्स आर यूजुअली नॉट क्लोज्ड, but do not miss your medication, because as I just said कि medicine की एक डोज मिस करने से भी सीजर हो सकते हैं. So the important part in epilepsy patient to remember, even otherwise and especially during this pandemic times, is जबकि कई बार medical help लेना मुश्किल होता है, कई बार OPDs जैसे बंद है, then you either have to go to emergency or telephone calls or something. It is good to be very meticulous about your medication so that you minimize your chances of having seizures.
Thank you, sir. I've taken a lot of your time. And viewers, if you have any more questions, any questions regarding anything you want to contact with sir, you can always inbox me, message me. I will email your questions to sir. And because he would prefer to meet when the pandemic is down or OPDs are open, he'd like to meet you one-to-one. And sir, thank you so much for your time. And I was very nervous while interviewing sir, but he's made me feel so comfortable. I thought, Pakka, I'll have a Caesar here today. But
no, don't talk about that. Yeah,
I've been very comfortable. And thank you, sir, so much. And we've had a wonderful session. And I hope all the doubts have been cleared. I hope everybody out there will go ahead now and take the vaccines. And I hope we don't need to have another session where no more questions need to be asked. And thank you, sir, once again. And Chardi Kalam.
Not a problem. Chardi Kala, yeah, not a problem. I am there to answer any doubts. If anybody has or you can let me know. And always there for spreading information about epilepsy. And thank you, and all the best to you and all your friends who are bravely living with epilepsy. And that's a very brave thing. Good.
Thank you, sir. Thank you so much. Thank you. Thank you.